Okay, this is a good question. There's a few different things that can impact it. So let's talk about this. Time of day, type of provider. Does your provider work in a practice where they rotate providers? Do they have to see patients in the office? So they're dancing back and forth during working hours between the office and the bedside. There's so much. Typically, an OB is going to be at the provider less than a midwife. That's just a very standard expectation. Is it always going to be true? No. But is it common? Yes. It is also very common for maybe the OB to swing by if we're talking day shift timing. Swing by, check on you, maybe they check your cervix if that's what's going on. And then there's kind of that, yay, let's start pushing conversation, and then they leave. And then the nurse steps in and they're just doing their job, calling the OB when it looks like you're about to deliver. The OB comes back over, you deliver. There's also the possibility that you are pushing for a lot of hours. Let's say it's 2 hours, 3 hours, we're pushing 3.5 hours. It's very likely your OB is going to be checking on you maybe once an hour, or maybe every 90 minutes, or maybe the nurse calls after 2 hours and says, hey, do you want to take a look at this and see what's going on? They can pop in, assess progress, something like that. They might leave again. They might stay if we're close. So it's hard to say. One thing that's really true about a lot of OBs is that, and midwives too, but if they're working in a practice where they're seeing patients like in the office, then they might be coming back and forth, right? So it's not necessarily like, I just don't want to sit with you and push. It's that they are seeing patients in between. At night, it's possible, or maybe more likely, your provider may spend a little bit more time with you because they don't have to think about, what's going on back in the office. Now, if they've got multiple patients laboring, then they could be doing that dance. And so they may be in another room related to that. And then I would say the other thing that's really possible here is that if you're seeing a midwife and that's who's going to deliver you, they often work where some midwives are in the office seeing patients, and then there's one midwife who gets to stay and be present. So they are there while you're pushing, or they're in and out, or they come and go as you want them to, but they're more present and not doing that back and forth. How do you know when to call the doctor? That's a good question. I think it's hard to describe because some of it is just experience as you start knowing what it looks like when the baby's close, maybe but not close enough, or kind of doing a dance. You can see the way the tissues are bulging. You might know because of a cervical exam, and so you're watching contraction pattern and efforts, and you see some descent happening. You might actually be able to see the baby a little bit, as they're slowly starting to crown, and that they're close. There's probably a little bit of an art to it. Certainly all of us have called at the wrong time, either way too early or way too late. So that's totally possible as well. If your provider's at the bedside, obviously the nurse doesn't even have to make that call. But I think there's a little bit of art to it, a little bit of skill to it, a little bit of just experience to it. And then that's how it works out.